The high cost of medications in the United States stands as a stark testament to the complexities and shortcomings of a healthcare system that often prioritizes profits over patient well-being. For many, the struggle to afford necessary medications is not just a financial burden. It is a matter of life and death. The intricate web of factors contributing to these inflated prices reveals a system in dire need of reform. At the heart of the issue lies the pharmaceutical industry's pricing structure, which is both convoluted and opaque. Unlike many other countries that impose price controls or negotiate directly with drug manufacturers, the United States allows pharmaceutical companies to set their own prices with little oversight. This freedom results in exorbitant costs for medications that, in many cases, are essential for maintaining health and quality of life. The lack of regulation means that companies often prioritize their profit margins, leading to a scenario where life-saving drugs are priced out of reach for a significant portion of the population. The U.S. patent system further complicates the landscape of medication pricing. By granting pharmaceutical companies exclusive rights to produce and sell a new drug for typically 20 years, the system effectively stifles competition from generic manufacturers. This monopoly allows companies to maintain high prices without the threat of lower-cost alternatives. Even after patents expire, some companies engage in practices like evergreening, where they make minor modifications to a drug to extend their patent protection. Such tactics delay the entry of generic versions, keeping prices high and leaving many patients struggling to afford their medications. Intermediaries in the pharmaceutical supply chain, particularly pharmacy benefit managers, PBMs, add another layer of complexity to the pricing dilemma. PBMs negotiate discounts and rebates between drug manufacturers and insurers, ostensibly to lower costs for consumers. However, this rebate system often incentivizes manufacturers to inflate their list prices, knowing that PBMs will negotiate them down. This creates a paradox where the initial price is artificially high, leading to a cycle of escalating costs that ultimately impacts patients, especially those without insurance or with high deductibles. For these individuals, the burden of high list prices can be devastating, forcing them to choose between essential medications and other basic needs. The consequences of these systemic inefficiencies are profound. Patients are increasingly faced with the reality that they cannot afford the medications they need. This situation not only exacerbates health inequities, but also undermines the overall well-being of the population. The inability to access necessary treatments can lead to worsening health outcomes, increased hospitalizations, and ultimately, higher healthcare costs for society as a whole. The current system fails to recognize that when patients are unable to afford their medications, the ripple effects extend far beyond individual households. They affect families, communities, and the healthcare system at large. Addressing the high cost of medications in the U.S. requires comprehensive reform that tackles the root causes of these inflated prices. Policymakers must consider implementing price regulations, enhancing transparency in drug pricing, and re-evaluating the role of intermediaries like PBMs in the supply chain. Moreover, fostering competition through a more robust system for generic drug approval could help mitigate the monopolistic practices currently in play. Until systemic changes are made to confront these challenges, the burden of high medication costs will continue to disproportionately affect patients, particularly those from marginalized communities. The time for reform is urgent. The health and well-being of countless individuals depend on it. A healthcare system that prioritizes access to medications not only improves individual lives, but also strengthens the fabric of society, ensuring that all individuals have the opportunity to lead healthy, fulfilling lives.